Welcome back to our virtual classroom for Learning Unit 3, Recognizing Diversity in the South African Classroom. The topic of this video is From Special Education Needs to Barriers to Learning and relates to Learning Outcome 3. With the paradigm shift from the old medical model of understanding inclusive education to an ecological systems approach and the recognition of diversity in the South African classroom, we see a change in the language we use to talk about inclusive education. We move away from talking about learners with special education needs, which was aligned to that medical model view of disability, to using the terminology learners with barriers to learning. This term aligns to the socio-ecological view, which recognizes that a breakdown in learning can happen due to factors outside of the learner themselves. The concept of learners who experience barriers to learning was used for the first time in South Africa in the report of the Department of Education in 1997, Quality Education for All, Overcoming Barriers to Learning and Development. In this report, the Department of Education identified barriers to learning as any factor that causes a breakdown in learning, and recognizes that these causes often sit outside of the learner themselves. According to the White Paper 6, a broad range of barriers to learning exist that may cause learners to be excluded from the learning system or experience a breakdown in learning. As teachers, we must recognize that a breakdown in learning can occur due to obstacles that exist in any of the systems of influence in the child's development. In South Africa, we recognize that these barriers are often related to the socio-economic context of our learners. We therefore distinguish between two broad categories of barriers to learning. Intrinsic barriers to learning imply that the cause of impairment lies within the child. If an intrinsic factor causes a barrier to learning, it means that the child's external circumstances are adequate in all respects, but that the impairment results in the need for learning support. For example, a specific learning impairment such as dyslexia, or a neurological impairment such as autism spectrum disorder, would be seen as an intrinsic barrier to learning. In contrast, extrinsic barriers refer to those that exist outside of the learner, that are obstacles in the system that hinder the learner from reaching his or her full potential. For example, poverty or abuse. Some other examples of intrinsic barriers to learning include health conditions, learning difficulties, visual impairments, auditory impairments, epilepsy, physical impairments, autism spectrum disorder, ADD, and ADHD. Examples of extrinsic barriers to learning include things like poverty or lack of parent involvement, or transport getting to school or lack of school infrastructure. For example, children with physical impairments not having access to ramps to gain entrance into their classrooms. Can you think of any other examples of extrinsic barriers to learning? In recent reports done in the last 10 to 20 years in South Africa, looking at the most prevalent barriers to learning, we have found the following. Factors relating to specific individuals and educators, various aspects of the curriculum, the pace of teaching, learning materials and equipment, and assessment procedures, the physical and psychosocial environment, including the buildings as well as the management styles of schools, and conditions relating to the children's home environments, as well as community and social dynamics. These factors are seen to be prevalent causes of breakdown in learning for our learners in South Africa. In summary, with the paradigm shift from the old medical model of understanding inclusive education to an ecological systems approach, we see a change in the language we use to talk about inclusive education.